July 4th means parades, barbecues, patriotic decorations, and of course, fireworks.
Sadly, it also means trauma doctors see a spike in injuries. Dr. Chad Wilson, Associate Trauma Director at Taub Hospital, is here with safety suggestions to keep you and your family out of the emergency room this holiday. Welcome, and I'm glad you're here. You see this every year, don't you? And we warn people every year, but what is a serious take-home message that you hope people will listen to today to prevent problems?
Take it seriously, be sober if you're going to light fireworks. I'm a fireworks enthusiast as well, but I recognize the dangers, and that's really what I'm an expert in, is seeing the injuries. I'm not an expert in fireworks, but I'm an expert in seeing the injuries and recognizing how serious they can be.
So what are some of the most common injuries that you see every year?
The hand injuries are going to be the most common, and sometimes they can be minor burns, but sometimes they can be incredibly disfiguring. And people can lose fingers and sometimes the entire hand, depending on the size of the firework they're holding on to.
And we know kids love fireworks. It's a fun time of year for them, but that's where the parent really has to come into play and keep a close eye on them, right?
Right. Lots of supervision is important, and really lots of space between the fireworks and the child.
And let's talk about some of the smaller ones and sparklers, for example. A lot of times parents, I know, think, oh, these are the harmless ones, the sparklers, but those can cause some serious damage as well, Doctor?
They can. I know that it's a lot of fun to have all the kids holding onto a sparkler, but I think if you're going to give a sparkler to a very small child, you don't know what they're going to do with it. So I think you have to exercise some restraint in giving a sparkler to maybe like a 4-year-old or 5-year-old, but probably a teenager can handle that responsibility.
Now, you mentioned hand injuries is one that you most often see, but what about eye injuries? Is that also a concern of yours?
Definitely a concern. You probably want to wear some eye protection if you're going to be lighting fireworks. You want to wear eye protection. You also want to make sure that no one is wearing anything that's particularly flammable, that there's nothing flammable fluids around. And hopefully you're lighting the fireworks in a place that is not near any buildings or roofs or anything else that could catch on fire.
And the other thing to remember too, Doctor, is not to relight or alter the firework in any way.
Correct. I would say one of the things that people sometimes have a firework that doesn't seem to light, and then they move in to pick it up, and then it explodes. So if you have what's called a dud, or a firework that doesn't look like it's going to light, you want to just let it be for as long as you can. And then even if you're going to go and try to pick it up, you want to actually disable it with a bucket of water or something before you pick it up.
And you probably need to just hope for the best and put all those precautions in place, but at the same time be prepared, right? So I'm sure you need to know where your fire extinguisher is.
Right on.
Make sure you're not wearing really baggy clothes that could, you know, absolutely accidentally catch on fire.
Correct. Be aware of your surroundings, be aware of the weather changing, be aware of all of those things. Anything could go wrong. And my best advice that I always give people is, if you really want to enjoy fireworks, enjoy a professional fireworks show. It's very little chance of you getting hurt that way.
Leave it to the pros, is what
right.
I always say. So if you do have a burn or something happens to your eye, what do you advise people to do in the immediate aftermath before they can get to a doctor?
Well, obviously alert 911 if it's severe, and then of course you probably want to put something cool on the some cool cloth on the burn and try to get some pain relief, and then just sort of evaluate it. If it looks like it's just a sunburn, you know, superficial, you probably don't need medical care for that. Anything that's blistering or deeper, you definitely want to come to the hospital and have that evaluated by a doctor.
All right, well, we appreciate you being here, Dr. Chad Wilson from Taub. Thanks for all you do for our community and so many people who are going to suffer injuries. We hope the best for them in advance. Yeah. All right.